that's unique about my services in general is that I'm in the school setting. So a lot of like therapy and other services, great services, but they happen after school. So something happens at school, they then, 2 days later might go see their therapist. But for me, if something happens at school, they can immediately, a teacher can let them come to my office or let me know and I can come to them. I think a lot of parents, they appreciate that, but then I think the kids also realize that, because I'm there, because, all QMHSs are in the buildings, that they have a safe place where if they're feeling overwhelmed or feeling angry, they have a place to go. I would say that it can be hard to kind of let, when you don't directly see something, if you don't have a student that is directly receiving the services, or you don't have a student at all, you don't have a child, you're older, your kids are grown, it's kind of harder to accept voting on those things. But, when you see it firsthand, I went from a job where I wasn't seeing what I'm seeing now firsthand. And, I would always say like, oh, those things don't happen, at third grade, nobody threatens this or that or whatever. And then I got in this job and I realized, man, there are a lot of people struggling with things that I don't want to say easily, but can be managed. They can be taught coping skills to improve. And without these services, a lot of people are going to be infected, and that's family members, the kids in the school that I service, but then also, community members, because it really does when we as a community, work together to improve everyone, then everyone's, status in life improves, everyone's mental health improves, and I think we're a happier world when we're all working together.